Subcommittee. I'm here to present SB 608, as the chair just mentioned. This is my third attempt at this bill. However, for the past 2 years, we have secured funding for the bill. Then now we just need to get the bill passed and signed by the governor. So first, I will be taking the committee amendments to update some of the terminology that is now being used, that it was outdated in a previous version of my bill. SB 608 at the core is looking to protect what the analysis so beautifully mentioned, the increase of STIs amongst young people. As the analysis noted, close to 50% of the cases, as most recently data shows, are being accounted by young individuals. And the lack of equitable access to condoms and protection across California is attributable to that increase of representation of them in that data. So SB 608 is looking to do a couple of things. Under the purview of this committee, I'll focus on the education part of it, is that we're looking to ensure that schools grades 7 to 12 cannot prevent health centers from making them accessible for the students, and cannot prevent from condoms being provided during an educational, public health, educational forum or conversation should a student ask for them. Outside of the purview here, the other provision that the committee does, that the bill does, is that prevents retailers, pharmacies from asking for a identification to prove their age, knowing that there is no age verification law in California of how old you have to be to seek out contraceptions at these locations. Madam Chair, and I'd now like to turn over to my two witnesses in support of this bill. Oh, last thing this bill does, so sorry, I apologize, pertinent to this committee, is we're providing authority to the Department of Education to comply with bills that have been passed in this space, the California Healthy Youth Act.
Good afternoon, Chair Patel.
You will need to turn your microphone on.
I apologize for that. Good afternoon, Chair Patel and Assembly members. My name is Joaquin Avalos, and I have just completed my junior year at Da Vinci High School, located in Hawthorne, California, in LA County. And I'm here today on behalf of hundreds of students that are in strong support of Senate Bill 608. Me, myself, I work very hard to be healthy. And a part of that is to understand how STIs actually work and how comprehensive sex education can help me and my friends become healthier. Expanding access to condoms in schools and communities and actually implementing comprehensive sex education would support us to lead healthy lives. California youth, and in particular, youth of color like me and most of my high school students, are disproportionately affected by the STI crisis. I know for a fact that students in my high school experience difficulties while trying to purchase condoms. For example, some are judged, some are asked for IDs, some are shamed, and some are even harassed in the process. Youth with low incomes are often left without the option to regularly use condoms to protect their health and to prevent unintended pregnancy from occurring just because of the cost. My peers and I need comprehensive sex education to make informed choices about our health and our lives. You all are the leaders that can change this. California needs you to take more action. Senate Bill 608 is a solution to this problem. California's youth deserves access. On behalf of students in California, I respectfully urge your aye vote. Thank you very much for your time.
Good afternoon, Dr. Patel. It's really good to see you and committee members. My name is Stefan Ocampo, and I am a board of directors for the California School-Based Health Alliance. I was also here last year as well, advocating for this. California School-Based Health Alliance supports 450 school-based health centers and wellness centers in K through 12 schools across California, and is also a co-sponsor of the Senate Bill 608, the Youth Equity and Access Act. While the California Health Youth Act already guarantees students the right to medically accurate sexual health education, SB 608 is the necessary step because it acknowledges without access leaves young people unprotected. Together, these policies provide a coherent, evidence-based framework. The California School-Based Health Alliance knows that the school-based health centers serve as a trusted, accessible source of clarity and care for the environment. They provide comprehensive health care, including confidential reproductive health care, to students who would otherwise face significant barriers to accessing care. But we still need to do more. According to the CDC's Youth Risk Behavioral Surveillance System, in 2023, 21% of California's high school students were sexually active, and 52% of them did not use a condom during their last sexual intercourse. I would also like to say that a part of this statistic as well, I was also a young mother, and I got pregnant at 15. So this bill is extremely important to me. Why is this? Teens are often shamed, harassed, and discriminated against when they try to buy condoms. Sometimes they are asked to show an ID or denied services because we appear to be too young. Despite the fact that there are no age requirements for condom or contraceptive purchases for students in low-income communities or areas with high STI rates, these barriers are compounded by lack of transportation, lack of privacy, and lack of resources.
You are at time. Please wind it up.
Okay. And I would respectfully ask for your aye vote. Thank you.
At this point, we'll take any public comments in support. As a reminder, name, affiliation, and position on the bill only. Thank you.
Chair and members, Kathy Mossberg on behalf of APLA Health and San Francisco AIDS Foundation, both in support.
Angela Pontes on behalf of Planned Parenthood Affiliates of California, in support.
Good afternoon, Madam Chair and members. Tristan Brown of CFT, Union of Educators and Classified Professionals, here in support.
Nicole Wertelman on behalf of the Children's Partnership, in support.
Good afternoon, Chair and members. Karen Stout here on behalf of the California Nurse Midwives Association, in support. Thank you.
Hello, Kelly McMillan on behalf of the American Academy of Pediatrics, California, in support.
Good afternoon, Bindu Makamla on behalf of the National Association of Social Workers, California chapter, in strong support.
Symphony Barbie on behalf of the ACLU Cal Action, in support. Thank you.
Good afternoon, McLean Rosansky with the Alameda County Office of Education, in support.
Madam Chair and members, Rand Martin on behalf of the AIDS Healthcare Foundation, in support. Thank you.
Good afternoon, Alejandro Solis on behalf of CPCA Advocates, in support. Thank you.
Seeing no other public comments, at this time I would invite two witnesses in opposition to please step forward. As a reminder, you have 2 minutes. You may proceed when ready.
Chair and members, my name is Greg Burt with the California Family Council, and we're in opposition to SB 608. First, parental authority. California law already gives parents a limited opt-out from sex education. SB 608 builds a separate channel for handing out contraception entirely outside of that framework. Under this bill, a 7th grader could attain condoms at school with no parental notification at all. Parents are the constitutional recognized primary decision makers for their child's health and moral formation, and courts have affirmed that authority for decades. This bill violates these rights. It also strips the decision from local school districts. A community that believes handing out condoms to 12-year-olds is a bad idea can say so today through its elected school board. SB 608 takes that choice away and imposes one answer on every district, no matter what the local parents want. The public health record cuts against this bill too. The CDC's own Youth Risk Behavior Survey shows that early sexual initiation correlates with more sexual partners and higher risk behavior. Teens who delay do better. SB 608 pushes the opposite direction by normalizing early sexual activity. And it treats condom access as if it were disease prevention, and it's not. The CDC is clear that condoms reduce but do not eliminate the risk, and they are much less effective on skin-to-skin infections like HPV, herpes, and syphilis. California is in a congenital syphilis epidemic right now. Handing condoms to minors without honestly communicating these limits creates a false sense of security. Abstinence remains the only method that is 100% effective. Honest policy should say so. We urge you to invest instead in strengthening the parent-child communication and encouraging self-control.
You are at time. Please wrap it up.
We ask you to oppose this bill. Thanks so much.
Thank you. At this time, we'll take public comments in opposition. As a reminder, name, affiliation, and position on the bill only. Thank you.
Hello, Brock Campbell from the California Baptist Capital Ministry. On behalf of 6 California Baptist churches, Woodward Heights and Eureka, Faith in Sheridan, Calvary in American Canyon, New Testament in Hanford, Faith in Atascadero, and Lighthouse in Santa Maria, we're in opposition.
Hello, Emily Campbell with the California Baptist Capital Ministry. On behalf of these 5 California Baptist churches, South Coast in Santa Barbara, Freedom's Way in Santa Clarita, Mountain Avenue in Banning, Solid Rock in Bellflower, and Silicon Valley Chinese Baptist in Santa Clara, oppose.
Damian Julian, full-time college student, in opposition.
Pastor Brandon Campbell, California Baptist for Biblical Values, and pastor of the Faith Baptist Church in Sheridan, California, in opposition.
Christine Campbell, in opposition.
Sarah Botches with Children Out in support. Sorry for the late.
Seeing no further comment in opposition, I will bring it back to the dais. Are there any questions at this time on AB 608? Seeing none, we have not established a quorum yet, so we will put this on call. Would you like to close?
Thank you, Madam Chair. I'll use this close to address some of the concerns from the opposition. I don't want 7th graders to be engaged in sexual activity. I don't think anyone wants that. I also disagree that if an individual gets pregnant at that age, they won't be successful. I have a young lady to the right of me who is testifying in the California State Senate who was a teen mom and is part of a national state-led organization who is successful in her own right. So I think I also want to denounce that kind of accusation. What is happening is that not every single kid is telling their parent that they're going to be engaging in sexual activity. We are not next to every single minor 24/7. The current chair of this committee has kids that by default says that she's not with her kids at this very moment. And while parents do their best to stay on top of what their kids are doing, we were all young once, and I got away with a lot of things that my mom to this day does not know. So we recognize that it is naive to think that we can control the entire actions of a young individual. But what we can do is when they make that personal, hard decision to engage in sexual activity at whatever age, that they have the resources necessary to stay safe. Because I don't think we can prevent them from engaging, but we can provide them with the tools to be safe and not be part of the 50% of the STI cases that fall between the ages of 15 and 24. This is a step in the right direction. This is not the end all to all teen pregnancies. This is not the end all to all STIs. But it does help to curb those STIs and to perhaps not have, as notice, we already have a decline in teen pregnancies, but this will help with the STIs. With that, respectfully asking for an aye vote. When appropriate.
Thank you. We will now move on to file item 5, and that is SB 965. Senator Blakespear. Please remember to turn your own microphone on when ready. You may proceed whenever ready. And as a reminder, your witnesses have 2 minutes each. Thank you.
Okay, thank you, Chair. Hello, colleagues.